day one to help with this pandemic. You know, we really have been through a lot, and we really want to find a way to help our members navigate the challenges we've all been facing. We hope this is the first of several webinars. We really want to continue to have an open dialogue tonight and in the future to address a lot of these issues. So the format tonight, we'll have a 45-minute webinar and hope to have each panelist present on a specific topic and conclude by answering a number of questions that have been submitted previously. Really, we have over 600 registrants and a good number on tonight for this webinar. And due to the number of people we have on the Zoom, we won't be able to monitor the chat or take any questions live, but we will be taping the webinar and post it on the site tomorrow. I'd like to address the panel. We have our current MDS president, Dr. Mary Jane Hanlon, Dr. Janice Moriarty, the immediate past president, who also serves on the Massachusetts COVID-19 Provider Advisory Committee. We have Dr. Thomas Trowbridge, former MDS treasurer and member of the Board of Registration in Dentistry, also serves on the Massachusetts COVID-19 Provider Advisory Committee. Dr. Alec Eidelman, former guest board member and member of the COVID-19 Resurgence Force. Dr. John Gisha, regional trustee, chair of the COVID-19 Resurgence Task Force. Kevin Montero, managing director of the Strategy and External Affairs with the MDS, who's been instrumental really throughout. And Ellen Factor, the managing director of membership and dental practice, who I want to thank for coordinating this meeting and all she's done throughout the pandemic. So I want to introduce our first speaker, our MDS president, Dr. Mary Jane Hanlon.
Good evening, everyone. It's really nice to see you all here, and thank you so much for attending. Before we get started, I thought I might start this webinar off by taking a few seconds to have a moment of silence for our country. What happened last night is such a significant event, and I do think that the frustration, anxiety, and fear that people are feeling, it was just exasperated last night. So if you'll join me just for a few seconds to remember everybody that might have been injured last night, and all the senators or anybody that might have been hurt, and in our police forces. And in addition, I think it might be nice too to remember all the people that have passed from COVID-19, all the loved ones that we've lost, and those that are close to us, because it has impacted all of us. So just a moment of silence, please. Thank you so much for indulging me for that. Obviously, tonight we're here to really provide a lot of content and answer some of the significant questions that have been coming in. I plan to do an update on a weekly basis of the things that we've been doing and what we've accomplished during the week since the last webinar. So this will take the place of this week's webinar. I did one last week. I hope that you have been able to view it, and many of the things on there we're going to talk more extensively about tonight. So just some highlights of some of the things that we know are happening in our state, and we recognize that frustration. Many of us feel the same way. You'll hear from many of our panelists that there's not a lot we can do about that. So some of the accomplishments that we've had since COVID-19 started is that we have become essential healthcare workers, and that is a major feat. All these years that I've been in dentistry, medicine for some reason, and who knows what, it's probably 200 years old, this whole issue with teeth not being a part of the body. And finally, we're being recognized as healthcare providers. We are being recognized as being essential. And I just think that that's a major accomplishment for the industry. We've also been able to keep our practices safe. The incidence of COVID-19 being spread in our practices is just indicative of how great our infection control measures are, and the practices that we put in place are really working. So kudos to all of you for going way out of your way to ensure that our patients are staying safe, because obviously we don't want to be that nidus for infection, and you're doing a great job, as well as your teams are doing a great job. So thank you. We're able to vaccinate now. I mean, that is a huge accomplishment. The governor has approved dentists being able to give vaccines. When that's going to be able to roll out, many our panelists, Dr. Trowbridge and Moriarty, can talk further about, as they belong to the provider advisory committee, and they will be able to give us more information about that. One of the things that is really critical is to also talk about the amount of work that your board has been doing. You know, I see the social media, we all do. And, you know, I tell people I've got a target on my back that's a mile wide. It's not going to be easy to miss me. But, you know, I do think that one of the things that I wish most of us could do, and those that have some negative feelings about your board, could just understand a day in our shoes. Just this week, you know, first week back, I had to do 3 or 4 interviews in between all of the already scheduled meetings I have. In addition, we had meetings every single night. We had a surprise meeting that with a search committee for our executive director that came up immediately on Monday night, which came out of the blue. And by Tuesday night, our executive director search was finalized and completed. So you'll hear more about that next week. But I just want you to realize that we're really not sitting around eating bonbons. We are trying our hardest to make sure that we're representing you, our members, all across the state and at the highest level. The Provider Advisory Committee, Dr. Janice Moriarty and Tom Trowbridge are representing us on that committee that serves the governor, and we are very proud of the work that they have been doing. The letter of to the governor that I wrote a couple of weeks ago has been very well received. We have not received a response. I'm not expecting a response. The governor has much more important things to do, but at least it's been acknowledged and they know that it's there. I do know many of you are participating in a letter writing campaign to your representatives and senators, and I encourage you to do so. You know, if that helps you feel a little bit better and become involved, please continue to do that. We have developed an extensive Q&A portal on the Mass Dental Society website. Please go to that site, because that site is where we're going to be updating information all the time. And last but not least, I'm really proud of the work that the Resurgence Task Force has been doing. We have been meeting on a regular basis. That has been chaired by Dr. John Gusha. And they've done an outstanding job keeping us on track, bringing up issues that are coming up in practices, whether they're in private practice, dental school settings, or public health settings. So without any further comment, I'll start turning it over to Dr. Janice Moriarty for the first question, and we have a bunch of questions that we're gonna go through and elaborate on, and then I'll close up at the end. Thank you.
Thanks, MJ. So I believe what I am going to answer right now is the question of how the vaccine priority order was determined. And as MJ said, Tom Trowbridge and I sit on a provider advisory group for the Office of Health and Human Services for the state. Let us just tell you that our committee did not create the timeline, but we are able to give our opinions on it. And we do that on an every other week basis. And we sit on this committee with representatives from non-hospital based healthcare, behavioral health, community health center organizations, the Mass Medical Society president and ED, and many groups like that. And I can first of all tell you, that everybody is just dying to get their vaccines ASAP, and we do get that point across. But in terms of the priority order, the state's planning, and a lot of this is found on their website, is based on guidance from the CDC and the Mass COVID Advisory Group. Now, the governor and DPH developed the distribution timeline after extensive consultation with the Max Vaccine Advisory Group, which again is not the group Tom and I sit on, That is made up of medical professionals, of public health experts, of elected officials, and leaders from healthcare, churches, and community organizations. This group is chaired by Dr. Paul Bittinger, MD, from Mass General Brigham, and actually includes Ron Mariano as one of the elected officials on the committee, who now, as you know, is our brand new Speaker of the House, and he is a friend to Mass Dental. So the timeline that they created and the reasons for the prioritization setting that they created, according to them, is to protect the most vulnerable, to maintain healthcare system capacity, and to address inequities in the healthcare access system. So again, there was a lot of thought, a lot of intent put into that. And that group, the Vaccine Advisory Group, you know, has very sound reasoning in their minds for how they set it up. And as you know, dental professionals are in phase 1. So that is where we are at right now. I have some other things to talk about later on. But again, every time Tom and I meet with our committee, we pass on the position of dentistry, and that is that we wish we were higher, you know, on the prioritization line, but we do understand the reasoning that they chose for what they chose. So dentistry has a seat at the table. We believe dentistry has been heard. We were also able to present way back in COVID. Dr. Mina Paul, Tom and I made a presentation to the Governor's Reopening Advisory Board. And again, we presented how dentistry would be able to very easily create a phased reopening for our own offices. And that was very well received. And again, it was part of the reason that dentistry has kind of been left on our own in terms of, you know, we're not applicable to any of these, you know, rollbacks in terms of size and capacity that the governor keeps changing. Every time they say, you know, group settings can be smaller and the amount of people in your facility need to be smaller, that doesn't really affect us because they know we have our very sound protocols in place. And pretty much every week dentistry is praised for the work that we have done. And that is all a testament to every member and every person on this call. And we want to thank you. We know it's frustrating to wait, and we're going to get to the timeline in a little while, but we do feel that sooner than later, we're going to be up on our turn. So Tom, you have anything to add to that from the Provider Advisory Group?
Not specifically. Again, I would sort of echo a little bit of what Mary Jane and you have both said, is that there's been some benefit out of this last year that we now feel like we've gained really a very equal seat at the table through many of these various task forces that we've been involved with. You know this, Janice, as well as I, that when we sit at that task force on HHS for the providers, we have a very equal footing and a very equal voice to the Massachusetts Medical Society, to the Hospital Association, to community health centers. And when the information comes out to those groups, it comes out to us on the same timeline as they have been getting it. So again, that's been a bit of a benefit to us in terms of just getting equal footing to all those groups as well, where sometimes we felt like the second child sometimes. I can move on and again say, so the priority list and the phasing that's come out is as it's shown on the website. So that priority listing was developed by that COVID task force, a very tight group, relatively early in the process. That priority and that phasing was approved by the CDC, and it really is, there is very little opportunity for that to be changed. So within phase 1, dentists are included as healthcare workers doing non-COVID facing care. I've personally had individual conversations and seen it around social media, and we acknowledge the frustration that people are feeling, that you feel like you're a little bit down the list, and we understand that, and we're working as much as we can on that. But again, we have to keep emphasizing we don't control the timeline, but we're working very hard on it. I've said this a couple of other places when there's not really a comparison factor here. Don't think of us as being compared to other states. every state has its own decision tree. They make their own plan, and Massachusetts doesn't have much to do with that, and they don't have much to do with us. We have a huge number of healthcare workers in Massachusetts compared to many other states in New England, and it's just a little different process. I was on a meeting, a webinar on Monday night with the American Medical Association, and Dr. Feinberg, who's with UMass Medical, reminded us of how wonderful this is and how much energy has been expended on getting the COVID vaccine this quickly anyway. The fact that all industries were able to come together and get a COVID vaccine within a year of the pandemic starting is pretty astounding. He reminded us that HIV, a vaccine, has been around for 40 years, and there still is no adequate vaccine been developed for that. So you might look at that as apples and oranges, but in terms of getting a benefit out to the country, we're still on a very, very short timeline. In terms of what dental professionals are being included in phase 1, I've heard a lot of agita, again, both personally and in various locations on social media, that the website does state healthcare workers doing non-COVID facing care, and it specifically says including dentists and dental students. So to put some clarity on that, at the meeting that Janice and I had with the organizers of this plan, the immunization director of the state, they were very, very clear to us that the definition of dental healthcare workers in that category is going to be very, very broad. So really, although they have said the words say dentists and dental students, that's going to include dental team workers, including clinical people and administrative workers who have patient contact. We understand what's on the website, but the planners are saying that very clearly to us, just as many have seen have happened in other places like hospitals and so on, that once it gets in the facility, the availability does expand. So they've told us pretty clearly they're expecting that when our turn comes, that the definition of, if you call it dentist, is going to be pretty expanded. I think I'll stop there in terms of my comments for right now.
Can I just add a comment? Tonight, I also invited the president of the Massachusetts Dental Hygiene Association and the president of the Dental Assisting Association, and both are in attendance tonight. And they were given this link to send out to their community, because we want our dental teams to understand that it's not just about us. It's about the whole team, and everybody is included. So when we talk about dentists, it's not just us, it's dental teams. So we will try to be more clear about that in our language to help you, all of you. But when we say that, we mean the entire dental team. And in fact, I had a lab tech reach out to me on behalf of some of the things that we've been doing. And there is no Massachusetts Lab Association. So I am going to keep him keep in touch with him and give him the information. But as dentists in this community of Massachusetts, I think it's a great idea if you are using a local lab. If and when we start rolling out this process and we start vaccinating dentists in this state, I think it'd be a great idea for you to reach out to your colleagues in the dental lab space also, so that they can get vaccinated. Thank you. Tom, next one is Alec. Thank you, Alec.
Yeah, and thank you everyone for being here tonight. We recognize that there's a lot of answers that you are looking for, and we'll try to provide as much clear and relevant information as we can. And so I'll begin to start to transition into where we are finding ourselves now. And it was just only 4 weeks or so ago that the emergency authorization uses were granted to the Moderna and the Pfizer vaccines in the middle to the beginning of December. And since that time, I will say that there's been tremendous amount of efforts that have been going into distributing those across the different states. And here in Massachusetts, and we're going to keep reiterating this phrase, our state-specific plans have been going somewhat according to plan, but they are not all perfectly. And I think that a lot of us are learning on the fly and making our adjustments on the fly, and we'll begin to try to be as realistic as possible with our conversations that we're going to be sharing tonight. And so as part of this, once that first 1A of the vaccination, the MCVP, the Massachusetts Vaccination Plan, went into effect, the larger healthcare organizations, the community health centers, these other COVID-facing organizations began vaccinating their healthcare providers. And within these organizations, there was also a similar prioritization of those that are at the highest risk and those that cannot protect themselves as much as we can in the dental office with all the PPE and the rigorous infection control protocols that we've been following into. And so at this point, now that we've begun to transition to 1B, where we are now vaccinating some people outside of these, such as those in long-term care facilities, those in assisted living, the emergency medical first responders, and everything of that sort, we are now transitioning into this opportunity for us, which are the dental professionals, to be getting our vaccines. And so I'm going to spend a moment just to review the 2 vaccines that have been authorized. And at this point, within the healthcare organizations that have been distributing the vaccines, the majority of the questions have now shifted towards the safety and efficacy of these vaccines. They were granted emergency authorizations use for their immediate, or not immediate, but the rapid acceptance and through the ACIP and the CDC regulations. And so because of them, we've gotten to know a lot of the safety and efficacy. And some of the most important things is the 90 to 95% efficacy of these 2 vaccines. And most of this is felt after the 2 weeks period. And so we're going to learn a little bit more later on, just as far as what things will be changing, and which there are going to be very little for those that do receive the vaccine within the dental office. And then as far as the actual administration of the vaccine, I think that there's been a lot of confusion sometimes around what might be expecting for those people once they receive it. And I will say this, is that the CDC and a lot of other organizations have done a wonderful job beginning to communicate, which is what we're trying to do here today, to the healthcare providers and then onto the public, the side effects that were going to be likely for these vaccines. You will most likely have a sore arm. There might be some other local reactions, such as some redness or other tenderness. There might be some general fatigue that you will be feeling in the days afterwards. And then you can also expect to have this very, very small percentage. And the CDC had recently come out with, I believe, and I don't want to be perfectly on this, but 1.4 out of 1 million for having an allergic reaction to this. And so that's why they're asking the questions of those that have had a shellfish allergy, or more importantly, even to that, those that have had anaphylactic reactions in the past, and those that have had adverse reactions to vaccines in their history. Those are the people that we are the most concerned with. Some of the major things that we do want to stress upon to you all as healthcare providers and onto the patients within the public is that these questions that are around safety and efficacy, we want to be sending a very similar shared messaging and communications with. And so if we have any questions that we do not have the answer to, and I'm sure that your patients are asking many questions about what to expect from the vaccine, it's great to be able to direct them to the CDC website, which has very clearly communicated information about what to expect within that. Now, that being said, as we go towards this communication and the acceptance of the vaccines, we do want to be honest that one of the biggest things that we are now facing across the country and here in Massachusetts, and we're going to try to stay as state specific as possible, is that many of the people, even when offered the vaccine, will be hesitant at first to be receiving it. And this is more than okay. And we don't want to try to have any judgment onto them or shaming these people that are making a personal healthcare choice. And as far as the legality of going into talking about if you can require anyone to be taking the vaccine under your practice, we'll get into that a little bit later on. But that being said, I do want to make something abundantly clear. And this is something that we've been hearing in many different iterations, but it can't be said enough. And that is that the vaccine is not the silver bullet that can end the COVID-19 pandemic. It's individual behavior and vaccinations that will be able to help curb the spread of the virus and to hopefully bring back this new sense of normalcy. And so the more we can enable our profession and then the public to have as much understanding as possible about the vaccination process, which is what we're trying to talk about tonight, the better we hopefully all will be. And so now I'll hand it off to Tom and Janice.
All right. I believe here, Tom, is where we get to talk about when we think that we'll actually hit our line on the prioritization. So I'll just quickly review again. We are the last line of phase 1, and that is healthcare workers doing non-COVID facing care. That doesn't mean just dentists, as we said, it's our teams. It's anyone that sees patients, anyone that has patient contact. So one question I know Ellen asked tonight was what about retired dentists that don't see patients anymore? I think the key, and Tom mentioned this a few minutes ago, is if you see patients and have patient contact in any capacity, then you qualify in phase 1. My understanding is if you're retired, even though you're a dentist, if you're not seeing patients, I think you have to wait till your age group's phase, which will probably be phase 2. But nonetheless, we had our last phone call with DPH this past Tuesday morning, and they did tell us, basically to watch how the phases roll out. And right now, as we know, first responders, which are line 3 on the phase 1, they are beginning their immunizations starting on this Monday. So they did say to us to watch the way the lines of priority are rolled out for a couple of different reasons. One, they think there'll be about a 1 or 2 week kind of warning. So we'll probably find out, as we did last week, or this week, first responders are up next. And very quickly, you see in the papers, first responders are now getting invited and being told where to go and what sites are going to be used. They also told us to watch very carefully where these sites are. They did not say that we will be using exactly the same sites, but to just kind of keep an eye on it. And if there are local facilities that, for instance, are giving the vaccine to your first responders in your town where you live or practice, it's very likely, it's not 100% certain, but it's likely that that will be somewhere that we would be able to get our vaccines. So keep an eye on that. They did tell us with all surety that in the next week to 2, don't shoot the messenger, but in the next week to 2, the infrastructure for our line and prioritization is going to be made known to us. Sad to say, but that is all we know at this time, right, Tom? They did not tell us anything other than that. But they do feel that when they roll that out, with all surety, we'll be able to be vaccinated in February. We're hoping very much so that it's early February. And as we have already mentioned, so much of this is not in our control. Supply chain issues are not in our control. How many people in each line before us actually accept the vaccine, which will directly affect the amount available, is going to affect us. But that is the timeline. And when you really read the mass.gov/vaccine website, lo and behold, it's all there. And they did keep pointing us very gently, firmly, and kindly to that website. It is all inclusive. There are many, many links that you can spring into from it. And it is updated twice a week. So keep checking it. Like if you checked it 2 weeks ago, it's not the same stuff that's on there now because it's constantly evolving. Tom, any more to add there?
Just add in is, again, it's just to sort of emphasize that they are doing this planning stage by stage. It's a very, very complicated plan. And we've been, again, as Janice said, we've been in constant contact with the people who are doing this. We had a meeting on Monday with several people, including the immunization director of the state. We offered our resources and they were open to that. So again, we continue to stay in contact with them. MDS is working with the DPH to provide our resources as much as we can and to what the best available that we can, including help with registration, supporting the process, and perhaps even some pop-up clinics as we move along through the process. But it does seem that the state right now is moving through phase 1, one bullet point at a time. So again, we understand the frustration, but our turn is coming and it should be coming very soon. I won't add a lot more on top of that. There have been a couple side questions about within the state. And one thing that seems to have come up is for those of us who are in border states, if you live in a non-Massachusetts state, but you work in Massachusetts, generally speaking, I can't speak on behalf of every state, but generally speaking, it's expected that this is the vaccination is providing based on point of clinical care. So if you work in Massachusetts, but live in New Hampshire, you should be eligible to receive the vaccine in Massachusetts, and vice versa. If you work in New Hampshire and live in Massachusetts, your eligibility should come from New Hampshire, not from Massachusetts. Again, revolving around this idea of clinical care and exposure. I think that's what I've got to say on that point there.
Okay, I guess I'm up next. First, I wanted to thank Janice and Tom for all their hard work with the advisory committee. They have been meeting nonstop, and they are a wealth of information, and they really do bring the ideas that we have on our committee and the Dental Society has back to the governor, and to try to advocate for all that we need in our private practices. Just on a personal note, I will say, as far as being in the queue to get your vaccine, I did today get a phone call from my urgent care center down, local urgent care center, that said that they had extra vaccine and would I like to get it early? And of course I said yes, but I would urge you to possibly, get in touch with your primary cares and to see different organizations to see whether or not they called me out of the blue, knowing that I was a dental provider. So they had sympathy for the work that we do and how we are close to patients, and the patients are not wearing masks, and that we should be getting the vaccine as soon as possible. So that was a positive thing. So I'm going to talk just.
John, can I add one more thing on top of that also?
Sure.
I've seen that. So again, hospitals frankly are having trouble getting all their staffs vaccinated because of the rate of acceptance. So I'm going to tell you personally what I've seen is that I'm an independent practice of the hospital. In all openness, I got vaccinated as a medical staff member of my hospital. But what the hospital did in the last week was they opened up providing vaccine to staff members of my office, even though they're not employed by the hospital. So there have been some dentists across the state who are on medical staffs and have gotten vaccinated. We would suggest you call that hospital and see if they have available vaccine to provide to staff members of independent practices.
Good.
Sorry, John.
No, thanks, because I had heard from my daughter's primary care that they had gotten vaccinated because St. V's had extra doses also. So the same type of thing. So do we still use the PPE we've been using even after we get vaccinated? The short answer is yes. We should view getting this vaccine as just one additional tool that dental providers have to create a safe environment for ourselves and for our staff and our patients. So we should continue to social distance in our offices and wear masks, the N95s, and practice good hand hygiene. The data shows that while the vaccines are up to 95% effective, they are not 100% effective. And so we know that there is a lag time between when you get the vaccine and when it is fully effective. And we also don't know exactly how long the vaccine will be effective down the road. So please continue to use your PPE even after you do finally get the vaccine. So how do we talk to our patients about the vaccine and whether they should be getting it? First of all, we need to realize that patients consistently rank dentists amongst their most trusted source of information. So begin your conversation with empathy and understanding for their concerns on what's going on in their lives with COVID and whether they should be getting the vaccine. But keep your discussions to the facts and to the science, and do yourself a favor and familiarize yourself with the CDC and the ADA websites, which have great information on the facts about the vaccine. But be careful answering questions related to medical information for either yourself or for staff members because of HIPAA regulations. But the bottom line is the data shows that the known potential benefits of the vaccine far outweigh the known and potential harms of becoming infected with the COVID vaccine. So be careful when you're talking to your patients, but talk in a positive light and try and get as many people vaccinated as we possibly can, just so that we can get to that herd immunity in the community. So I think that's all I have. Now the question and answers on Ellen and Garrett.
Sure. Thank
John,
you,
can I add in one thing at the end here? I'm sorry. There have been two big parts to this. One is when can I get the vaccine? And one is when can I give the vaccine? And I can just give a very simple little update on that. So I've seen a few questions even here tonight, and I've seen it on Facebook. So I can report that at yesterday's Board of Registration and Dentistry meeting, the Board of Registration voted and decided that doing vaccination is within the scope of practice for dentists and dental hygienists with permit L. I repeat that vaccination is within the scope of practice of dentistry in the state for dentists and hygienists with permit L. That does not mean that tomorrow you can call the state and get vaccine delivered to your office. Becoming a vaccine provider is a significant administrative project that has a lot of layers to it and is not a very simple and easy task to undertake. And it certainly doesn't mean that you can get vaccine and jump the list here and get you or yourself or your office or your friends vaccinated more quickly than our turn is coming. However, this is one of the things that we've been working on also as a dental society and coming together with our medical colleagues. So I think this is another good step forward, and we'll be continuing to work on that project as well.
Thank you, Tom. So thank you all of the panelists for your information. So we asked when people registered to submit some questions. So the following are a bunch of questions that have been submitted on behalf of our members. Some of the information hasn't been covered, but I think it's important just to walk through these questions and re-answer some of them just so that the information is reinforced. So MJ, this question I'm going to pose to you to start it off with. Can you explain quickly kind of where dentists fit into the priority order?
So all dentists fit into the group 1, and we don't have our group divided into group 1A or B in the state. So it's critically important to understand that. There is a priority list, the bulleted list, and I can go through that right now for you. Clinical and non-clinical healthcare workers doing direct and COVID-facing care first. Long-term care facilities, rest homes, and assisted living. Emergency medical services, police and fire. Congregate care settings, including corrections and shelters. And I just want to elaborate on that a little bit. You know, there's been a lot of chatter on Facebook and Instagram about us being behind prisoners. And I think that the reason why they put prisoners and congregate care settings before us is because of the close proximity that the cells have to one another and the potential for it being a nidus for infection. So I totally understand that, and from that perspective. Now, by choice, I would prefer to be ahead. And in fact, the CDC sent out guidance on December 28th, stating that dentists and their team should be in group 1A. But our state doesn't have the division of group 1A and 1B. So we got to understand that we don't have that place. And then last is our healthcare workers doing non-COVID facing care, including dentists, dental students. Question in the chat came up about dental students because that's my space. I'll answer it. The governor also asked that each one of the dental schools partner with their hospital if they were associated with a hospital setting. We are associated with Tufts Medical Center. Harvard is associated with Beth Israel, and BU is associated with Boston Medical. So all three of the dental schools providers are being vaccinated. And yes, they are starting next week. In fact, some of the members' children have already been vaccinated. So the bottom line is, yes, there are many of your colleagues that may be doing some volunteering at the dental school that may get their vaccination before you, but that's a product of the governor asking us to partner with our healthcare facilities. As far as the phase 1 is concerned, we estimate that it's going to be sometime before February that we get it. And like Janice said, we hope to have information in the next 2 weeks.
All right, thank you. Thank you. MJ, I have another question for you. Can you tell us who's included in the dental professional category?
We include everyone on the team. I think we addressed that earlier. So hygienists, front desk staff, assistants, anybody that works in the office to support the dental practice is involved in the dental team, is in our category.
So the next question up, Tom, can you just address this one? Where are dental professionals going to receive this vaccine?
So again, I'll emphasize that the plans are being developed one bullet line at a time. So what's being set up for the first responders is a example or a planning model for what will come next. However, the first responders oftentimes are being treated in police stations and in fire stations. So that's may or may not be a practical spot to have healthcare workers done. So again, that's why we're staying in frequent contact with the people that are doing the planning at DPH. So I can't answer that question specifically, but we're hoping to have that information, as Janice said, within the next 1 to 2 weeks.
Thank you.
All right, I'd like to ask Janice, again, I know we spoke about this, it's the big question, but when will dental professionals receive the vaccine?
So as we mentioned, we believe, and we've been told by a DPH, and this is according to the timeline that's on the mass.gov website, it should be February. We don't know exactly when in February, again, because that is, depends on so many different things. But they said within a week or two, we should have definite information available to us. How do we receive that information? I believe that the state will obviously make a big announcement like they did for the first responders line of prioritization. So, wouldn't it be awesome if Governor Baker in a presser actually said dentists in a press conference? That'd be cool. We don't know if he will. He may not, but he may just term it, non-COVID facing healthcare providers. I saw a question in the chat, does that include ophthalmologists and optometrists? Again, if you're an optometrist or an ophthalmologist who sees patients who are non-COVID, positive, then I believe that's your category. It is not dental specific. So we believe it's going to be February. They're pretty much sticking to that phase 1, phase 2, phase 3 timeline. And unless there's a huge glitch somewhere, we hope it will move more quickly. Again, I believe that they are saying they're expecting about 60% acceptance rate by each group because of vaccine hesitancy. We know 100% of people on this panel right now may not want to accept the vaccination when offered. Some of them have already been offered it. Some of them have already received it. But, the fewer people in the lines ahead of us that actually get vaccinated, the more will be available when it comes to us and the sooner our line will be reached. But we are fully expecting that will be in the month of February, Garrett.
Thank you.
Thank you.
Can I just layer on top of that, Janice, what we've heard from a lot of people is the frustration of Massachusetts compared to other neighboring states. And so the places you're really hearing about are the states that are already getting, the dentists are already getting it. But I've talked with colleagues across the country. I spoke with a colleague from Ohio last night, and he told me that the dentists have no plan whatsoever when they're going to be getting the vaccine. So understand this is coming soon to us. This is a Massachusetts plan. The New Hampshire plan is a New Hampshire plan. Connecticut is a Connecticut plan. There are many, many factors involved in planning this rollout. And that's, again, to keep that in perspective.
Right. I was on a first district meeting last night with a rep from every state, and we're all over the charts. Some have already gotten it. Some states, all of their dentists and dental professionals have gotten it, and some of us haven't at all. And we are not alone in New England of not having received it. So I know it stinks. Believe us, we are, we wish it could move faster. But again, some of it is outside of our control, not for lack of trying, believe me.
Thank you. Alec, can you answer this question for us? There's been a lot of questions that have come in regarding, do we think that we'll be setting up a distribution center at MDS in Southborough?
Best of our knowledge, MDS will not be a vaccination site, and that the state will be publicly displaying on their COVID-19 vaccination pages where they're showing where the distributions of different vaccines are happening. You can see the different categories of the different facilities that the supply chain are being supplied to for the vaccines. Up to this point, the last numbers I saw was that 95% of them were all done in a hospital setting, some kind of hospital setting.
Thank you.
Can I pipe up for 1 second? I think that being said, you know what? It doesn't hurt to volunteer. So if you are a dentist or a hygienist or an assistant and you see in your city that they're going to have a site to deliver vaccinations, call up and say you're willing to help out. I think Tom said the same thing. You never know. They may never call you back, but wouldn't it be great if they did? So I have tried that in my city. I live in Malden, and their first responders start getting vaccinated a week from tomorrow. So far, I haven't gotten any response, yay or nay, but I'm going to try. And I'm particularly interested to see how the whole thing is going to roll out. So I'm hoping they take me up on it, really not to administer, but just to be there as a logistics person. So I will certainly let you guys know if that happens.
Thank you.
Right.
There've been some, to layer on top of that, there've been some questions I saw in the chat coming up about specifics of what will happen on site. And that's all determined by the administration of each individual site. So it's difficult for us to kind of lay that out in terms of how the actual process of the vaccination visit would occur, and that sort of that recommended 15-minute watch period afterwards, because it depends on the building, the structure, the location, the administration. So we can't really tackle that because that's handled by each location.
Thank you, Tom. I have another question. I'm not sure who wants to take this one, but we've had a lot of questions that ask us, are we able to require staff to receive the vaccine? Can we mandate that in our offices?
Alec, I think you were going to take that one, weren't you?
I can begin to it, but for this one, we're not going to give a crystal clear black and white answer for it. One of the things that's really important for this question of mandating is that there's a lot of facilities that require vaccinations by their employees in order to have a contract with them. Those are usually established at the onset of an employment. To be able to add this on for an emergency authorization use vaccine is not necessarily something that we're comfortable with saying that everyone has the authority to require it of their practices. And so I'm not sure if anyone wants to add on to that.
Alec, just as a note, the ADA just posted a good article on this specific topic, and their bottom line answer was yes, that we could mandate it, but during this process where it's in the emergency use authorization, just like you said, it's a really kind of a gray area. And so, but if you're at all thinking of mandating it in your office, I would urge you to go on the ADA website and read the legal opinion on that.
Thank you. I know that we've covered this several times, but it's come up in so many different ways. Why are some states ahead of us by giving vaccines? Tom, can you give a short answer on that?
Well, there are many factors involved in it, and I understand it's frustrating. But again, I have to keep emphasizing that each state's plan is developed by that state. They make individual prioritization schedules and decisions. It has a lot to do with the number of healthcare workers in our state, in each individual state. The governor leads that process, and each one of them make a different decision. And again, I just keep trying to emphasize that look across the country, we're not that far behind many other places. Again, there are a lot of other states where the dentistry has no point in the queue at all yet. So this is not a competition. The most important thing is that as many people get vaccinated as possible. And I've heard this in many places, including Mass Medical Society webinars, that getting vaccinated is not a substitute for all the protocols we've been doing for the past year. Because you get a vaccine doesn't mean you can abandon the PPE and the social distancing and the spacing and all the other things that have been done. So I think Alex said in his talk that it's not the vaccination is very important, but it's multiple factors at this point until there's a much broader level of vaccination across the citizenry.
Thank you.
All right, thank you. And I have another question for you, Alec. Can you tell us, does the MDS officially support vaccines?
as a professional organization, the Mass Dental Society can support and endorse the vaccinations recommendation from the regulatory bodies. And even though that's a lot of buzzwords in a row, what our professional capacity is capable of doing is we are not a clinical organization. We do not provide clinical care. However, we can be a voice and try to communicate. And so we are, similar to an organization such as the American Medical Association, we are endorsing the CDC's and the ACIP's urging of professionals to receive the vaccination when they are able, when it is offered to them, and when it is safe to do so.
Thank you.
John, this question is for, maybe you can address. People who live in a border state, where should they be going to get these vaccines? Live or work, I guess, is the question.
Sorry. Tom talked about this a little bit. So we're in phase 1 because we're dentists or dental personnel. And so it's generally expected, that we will receive our vaccines in the community where we work. And so if you work in Massachusetts, then you would expect to receive the vaccine in Massachusetts. That being said, we've talked about this a little bit and said, listen, if you really want the vaccine and you happen to live in a neighboring state that provides it earlier and you're able to get it, then by all means try and get it there yourself. But in Massachusetts, it will be determined by the place that you work.
And I'll piggyback on that. We're not certain at all what registration system will be used, but we do believe other states have told us that, the invitation to make an appointment is generated by your license. So again, where you practice, and they typically notify, the doctors in the practice. And then I believe if it's similar to most of the structure, you need to name like a contact person. And that contact person would then list all the staff people and their, the capacity in which they work for you. So i.e. name, and does this person have patient contact? And that's again, how you qualify for phase 1 under our guidelines in Massachusetts. Irrespective of any other state, that's how, it is set up for us. And then, we also can't forget commercial pharmacies, and that's going to be a big part of this as well. The federal pharmacy program includes Walgreens and CVS, but I happened to receive my shingles shot today, my second one, and the pharmacist that gives it to me happens to be my patient, which I think is kind of funny because I give him enough Novocaine injections over his lifetime, and he finally got to jab me in the arm. But, I said, you work at Rite Aid, are you going to be involved in this? And he said, absolutely. And he said, we do this all the time, and we're very well equipped for it. So, that's going to be a part of it as well. So obviously pay attention to your emails, and we don't know the exact system that will be used, but when we receive it, it should be fairly straightforward, we hope. And as soon as it's out there, obviously Mass Dental will, blast it from the mountaintops. So keep an eye out in the next 2 weeks, because we don't know this any more than anyone here, but we have been told there's news forthcoming fairly quickly.
Thank you.
All right. So I just want to ask again, so will dentists be able to administer vaccines to our patients? I mean, we talked about this a little bit, but a lot of dentists are asking if this is a realistic thing for us in our state. Is this something, again, Alec, that you want to talk about quick?
You want me to take that again, or?
Yeah, Tom, that would be great, actually. Thank you.
Again, it's an allowable process. However, it's not an easy process. Again, you have to get enrolled in the state vaccination system first, and then be invited into the mass COVID vaccine plan. And both of those systems have very significant administrative work involved. I'll remind you that with the Pfizer vaccine, it requires an ultra cold storage system. In a little bit of research and looking that up myself, when I went and got it to the hospital, I saw 3 of those ultra cold freezers lined up. I checked today on a website. One of those ultra cold freezers cost $12,000. So it's not an easy project or process to get involved in. However, yes, it is a possibility, and there are other vaccines don't require that ultra cold storage. but it requires multiple layers. It involves other issues such as both enrollment. They look for site management. They look for storage. They look for record keeping. You have to report this through an EMR to the state. I know how much dentists love EMRs. These are multiple layers of requirements in order to become enrolled and involved in the system. So the simple answer is yes. However, it's not an easy process to get started in.
And
Right.
briefly, one thing
Sure.
to highlight of this, it is a major accomplishment that within the MIIS eligibility and registration process, there is an option for dentists to register for this. Assuming you have all these administrative and clinical requirements, that in itself took effort, and it's great that we were able to accomplish that.
Right, and thank you both. And Tom, I just wanted to mention, I've heard that, so the Pfizer vaccine I've heard does need to be stored in this ultra cold system. I have heard that the Moderna one has, it's a little easier to store, but it has a shelf life, and that is one reason why St. B's and other offices have been trying to just find people that can, take the vaccine like a dentist. I've heard that's one reason why we're really trying to use up some extras. So I would just keep that in mind, and there are extras around, and it's just something to think about.
Okay.
So I've seen a few questions come up about vaccination planning. There's some interesting questions. So what hospitals have done, so very quickly, some people have asked about whether to vaccinate an entire staff at a time. So what hospitals have done where they have large numbers of healthcare providers, and this is just a suggestion, they have not had everybody vaccinated at the same time, because as Alex said, there are a certain number of people that are going to have side effects that may keep them out of work for a day or two. So most hospitals are doing pretty significant staggering of their personnel when it gets rolled out to them, so that it doesn't put a downer on their support staff to keep things running. So a suggestion would be perhaps to not think or expect to get all the staff vaccinated on the same day, because you may find that perhaps actually the original article said up to 80% of patients can have side effects, but you may have several staff out the next day due to these minor side effects that you weren't planning for. So just generally a suggestion would be to think about staggering once it does become available.
Thank you. Just a couple more questions. Janice, am I understanding that there's no way right now to pre-register for the vaccine?
Yes, you are correct that right at this moment in time, there is no way to re-register that we're aware of. I don't think Tom or I are aware of that yet. We do believe that information should be rolled out with the infrastructure that they revealed to us in the next, as they said to us, week or two.
Great.
All right. And John, can you tell us do you know of any ways that we can volunteer to help with vaccination drives?
Thanks, Garrett. So presently, there's no statewide program for us to be able to volunteer. Dentists and dental personnel are asked to contact their local health departments, the community hospitals, and community health centers in order to volunteer. So MDS has offered several times through Janice and Tom to provide volunteers for any kind of rollout that they need to be able to develop. And so we are continuing that effort to see whether we could partner with a major institution to help speed this process along in any way that we can. We know that dentists are capable of giving injections, and so the idea of us volunteering is actually quite noble, but it's also quite prevalent. We've gotten that question quite a bit.
Thank you.
Tom, we know that the first responders are starting, I believe, the end of this week or the beginning of next week. At least they're signing up shortly. Do we think the same locations will be available to receive vaccines that they're setting up for first responders for dental professionals?
Well, I can't answer that question specifically, but with conversations we've had, I would sort of doubt it. That's really all I can tell you at this point. I think what they're doing is they're taking every level and learning from it and moving on to the next thing. And it seems to be evolving at every point. For instance, you might think it would be almost easy to, if once hospitals have set up vaccination sites, to just send the firefighters there, but they're not really doing that. So I would sort of doubt that the sites that are being set up for the first responders will be mirrored and carried forward into the next level. Again, whether that's good or bad, I don't know, but that's my suspicion.
I might say, again, only going on what I've seen where I live, they're using police stations, but then in Melrose, they're using a large community center. So I would foresee perhaps, not using the police station for other priority lines, but perhaps using that large community center as one. But again, we won't know until it rolls out. And we have the pharmacy program. And when they say that, pharmacists will come out to certain places. So this patient of mine that just gave me my shingles vaccine today, their staff is getting deployed to long-term care facilities, and they're getting deployed to these sites for first responders to actually administer the vaccination. So it's not 100% that, we have to go somewhere. It's possible if you work in a real big place, maybe a vaccine administrator might come to you, but I think it's going to be well publicized. I hate to keep saying it, but we just need to wait another week or two. And if you don't find the information, and I don't have it on the tip of my tongue, but there is a very well publicized question email address where just ask your questions. They encourage that. The state is very open to questions and criticisms, and it's on the website as well. So ask away, and hopefully you'll get the answers you're looking for. But obviously Mass Dental is a great resource.
I'd like to do a quick plug for the website. So it's massdental.org vaccine/information.
All right, thank you. So I have another question, John. We've had a lot of retired dentists still active in the society. They've asked if they're going to be included in phase 1.
Yeah, Janice talked about this earlier, but the short answer is no. Unless they're doing direct patient care, they wouldn't be allocated in phase 1. We did have one question from someone that is semi-retired. They aren't treating patients right now because they wanted to avoid the COVID possibility of treating a COVID patient. I would think that person would be considered active still and would still be in phase 1. There is, if you are over 75, you will be at the beginning of phase 2. So you'll be right after dentists. If you are retired and over 75, you would be getting the vaccine just right after medical personnel anyways.
And I might piggyback on that, John. Again, I could probably think of 25 of my friends that have already been vaccinated, but they've been vaccinated because they're connected to a facility that offered them the vaccine. So that may be pediatric dentists that go into ORs every week. That may be oral surgeons that go into ERs and ORs and ICUs. But if a retired dentist perhaps is a volunteer faculty member at a school, it's possible they may, be invited to get vaccinated under that setting. So that is something for them to think about. And that is how, I know people are like sometimes annoyed that why did this dentist next door to me get vaccinated already? I think if you ask those people, they have an affiliation with a facility, a school, or an OR, ER setting, hospital, where they have been able to, be in the COVID facing, which is the top line of prioritization of phase 1. So, everything is not apples to apples. As long as we all get an opportunity and we get the opportunity fairly quickly, I think we'll be in good shape.
All right. I was just going to say thanks for adding that, Janice. And we just have a few more questions. Just want to thank everyone for staying on.
Janice, in summary, when do you think more details are going to be available about the distribution place, the registration process, and how will people listening to this webinar find out those details?
You're on mute, Janice.
Oops, sorry. Can you hear me now? Yes, you can. We were told 2 days ago that it will be in the next week or two. So they do update their website every Tuesday and Thursday at mass.gov/vaccine. And again, I would hope that on one of these press conferences, we would hear that, hopefully next week we're going to hear that the congregate care line is coming up, and the next week after that, that the home health care line is coming up, and then after that it's us. But they have said point blank to us, keep a very close eye in the next week or two. So if we take the state's word for it, that's all we can do. Tom and I is relay what we've heard in our meetings. And they also assured us that February will be the month that our last line of priority in phase 1 will be offered the vaccine.
And I know that we'll publish it in e-news as soon as we have any information available.
Correct. I'm sure as soon as that hits, probably some people will get emails before we even hear that it's started, right? That's always usually the way it happens. But, obviously I think it will be widely publicized when it happens.
Great.
All right, I have a question for Alec. Do you have any information about the safety of the vaccine?
Yeah, it's a great question that we can't emphasize enough, that these are safe. These were robust clinical trials that investigated the side effects and adverse reactions, and they were granted emergency authorization use because they are safe. Just to reinforce a few things, the major concerns, and this is not an exhaustive list that is all-encompassing, are those that have had previous reactions to vaccines, those that have anaphylactic reactions to certain things such as shellfish or other things of the like. And then there's this other category I do want to mention quickly because it was brought up in the chat. They are recommending that people that have had molecular tested and documented COVID from the last 2 to 3 months, that they have protective immunity for that time period, and that you may not need the vaccine within that time period. So just because you had COVID-19 doesn't mean that you would have enhanced disease if you have the vaccine, but they're saying that you are protected by immunity for the 2 to 3 month period afterwards.
Thank you. Any other comments any of the panelists want to offer before MJ wraps this up for us?
This was a state-specific plan.
Okay, thank you. I'll just hit one of the last comments that just came up. I don't have the time to respond. Registration, when we get the plan from the state, we will have a registration plan put into effect, and you will be notified about that plan as soon as possible, or where to get your vaccine. So as soon as we have the information, you guys will get it within 24 hours, because we just know how anxious everyone is and that we're all waiting. So to that end, please make sure you're reading your emails. Please make sure you're paying attention to the notices. Watch the MDS Facebook page, watch the MDS LinkedIn page, wherever you go for your social media, pay attention to our pages, because we are going to put the information up there. And just to remember, we are going to have hiccups with our plan too. It's not going to be perfect, just like the states has not been perfect. This is the first time that we have ever gone through such an ordeal. The federal government didn't have an existing plan, or at least it didn't have a plan that it could roll out immediately like that when this pandemic hit. The states were not prepared. And as an industry, we are not as prepared as we could be. However, I do know that being on the state board, that we are very organized in our structure. We know exactly how we can break down areas of the state and get the information to you. So please pay attention to any portal that you are. And I want to remind everyone, please just continue to stay vigilant, try to stay safe. Don't get into big groups, keep your social distancing. We are all exhausted. I know, I get it. We are all exhausted. And now is not the time to let your guard down. I think that by springtime and hopefully by Dental Palooza, we'll all be back together again and giving each other a hug and a high five that we survived this crisis. So to that end, the webinar is going to conclude. As soon as we have more information, we'll certainly pass it along. Thank you all so much for attending. And to all my panelists, thank you very much for all your valuable information.
Thank you to MDS for helping to organize this.
Yep. Great job, Garrett, and the membership committee.
Absolutely.
Excellent. Thank you. Thanks everyone for coming on to our Zoom. And again, I want to thank all the leaders present today and your teams just for all you've done since day one. And we'll hope to do another webinar soon and especially be active on our page and website. So thank you. Please tune in. We'll see you guys all soon.